For centuries, patients bled, burned, and faded, while doctors argued, blamed stars, and wrote notes, never seeing the invisible killer already living inside them. Moving, spreading, waiting, winning, quietly, patiently, everywhere, unnoticed, by learned minds alone. Medieval wards stank of iron and fear, where healers prayed loudly, cut deeper, and swore sickness traveled through bad air and moral failure. While bells rang, candles smoked, bodies weakened, families watched, helpless, night after night. Treatments worsened agony, bloodletting drained strength, mercury poisoned minds, and isolation stole hope, yet confidence remained absolute behind starched coats. Of authority, tradition, hierarchy, ritual, fear, pride, error, repeated daily, endlessly, publicly, painfully, knowingly, blindly accepted. Victims died obediently, trusting wisdom passed down unchanged, while the disease spread silently between meals, beds, hands, and kisses. Crossing borders, classes, cities, years, generations, hospitals, homes, families, empires, unnoticed, unquestioned, unnamed, misunderstood, lethal, persistent, patient.
She was a mother watching fever steal her child, hearing doctors insist nothing contagious existed, only weakness, temperament, fate. As linens were shared, hands unwashed, water reused, hope shrinking hourly, prayers breaking, voices shaking, rooms closing. Every funeral felt personal, yet society called it normal, seasonal, unavoidable, refusing to connect the obvious pattern forming. Before their eyes, across streets, wards, schools, factories, ships, armies, births, deaths, calendars, ledgers, memories, again. Years passed before one observer questioned authority, noticing caregivers fell ill more than patients, and numbers finally mattered. Over reputation, doctrine, comfort, habit, fear, punishment, ridicule, exile, silence, poverty, doubt, persistence, courage, data, truth, emerging slowly.
Microscopes improved, experiments repeated, and the unseen became visible, rewriting blame from air to organisms, from sin to science. Through proof, sweat, resistance, careers ruined, names mocked, papers rejected, nights sleepless, minds sharpened, patience tested, truth. Suddenly, protocols changed. Wash hands, clean tools, separate sick, measure outcomes, and death rates collapsed astonishingly fast, leaving silence where screams once lived, disbelief replacing certainty, anger replacing denial, relief mixed with grief for lost millions. But acceptance lagged. Pride fought evidence, institutions resisted change, and pioneers paid with careers before humanity listened. Because admitting error threatened power, tradition, hierarchy, funding, ego, certainty, control, comfort, myth, legacy, authority, memory, identity, history, itself. When truth prevailed, it wasn't triumphant, only quiet, measured in lives saved rather than applause earned. Because progress often arrives ashamed, late, carrying names we never learned, faces forgotten, children buried, lessons costly, permanent, irreversible, instructive. This disease taught medicine humility. That certainty kills, curiosity saves, and listening to evidence matters more than status. Especially when lives depend, patterns whisper, data accumulates, suffering repeats, warnings echo, margins scream, anomalies persist, quietly, patiently. Today, hospitals glow cleaner, safer, but echoes remain whenever new illnesses challenge comfort and force uncomfortable rethinking of assumptions, habits, incentives, authority, speed, certainty, funding, bias, training, fear, urgency, responsibility, memory, vigilance, courage, empathy, science. Again, history asks us to remember the cost of ignoring patterns and the bravery required to see differently. Before bodies pile, excuses harden, rituals repeat, harm normalizes, and preventable deaths feel ordinary, distant, statistical, tolerable, acceptable, invisible. Learn from medicine's past. Like, share, subscribe, and comment if truth should always outrun pride. Together, today, here, now, please, friends.